Hello, my name is Mariana Barahona, and I am the Community Education Coordinator here at Gateway to Hope. Today's topic is going to be Introduction to Addiction and Substance Abuse, keeping in mind that we are in a workplace. One thing to keep in mind is that the way that I run the trainings or that we're going to go about this presentation is we're going to keep in mind the 3 R's. The 3 R's are how to recognize a mental health problem, how to refer to a mental health professional, and then how can we relate to those in distress. These tools are going to help us build a healthier conversation around mental health and also about the topic that we're going to be covering right now. The first R is going to be recognizing. It's very important that we understand that it's never going to be these conversations that we lead at Gateway to Hope. It's not with the goal of diagnosing. The goal comes from the first level of really trying to educate the community, family, employees, individuals about the signs, the symptoms. What does it really look like to have mental health illness or be faced with mental health challenges, whether it's a diagnosable situation or just a situational component that really brings or challenges our mental well-being. Since we are talking about alcohol and addiction and substance abuse, it's very important to address the myth to really start targeting the false information that can be really out there in the community. One of these myths is that addiction means you don't have any willpower, which, as much as some people think, of course, everyone knows that. Not everybody knows that. It's a myth that we constantly need to debunk to people, shift our mindset on, because studies have shown us that addiction is a disease and it's not a choice. It does not mean you're being weak, but it does mean they need help. One other myth that we want to continue to address is the myth that people struggling with addiction can stop at any time. Sadly, this is not a cognitive decision that somebody struggling with addiction can just automatically turn on. This is very much a physical symptom, and studies have shown us that there is a layer of your body that's physically needing the substance, which is now what creates dependency. And we'll talk a little bit about it here in a couple of slides. This is to kind of give you a visual to add that shock factor, if you will, to the conversation that we're going to have. Is going to be what a healthy mind looks like and what a drug user's mind looks like. You see that there's less activity. There's less areas of your brain that are quote unquote awake because of the damages that the brain has occurred due to this addiction, the substance abuse, and so on. So this is just to create that shock factor to understand that this is not a willpower situation. This is way beyond that. So let's talk about what is substance abuse. We know that substance abuse, actually 17 million people or adults here in the United States usually struggle with both a mental health illness and substance abuse. So sometimes is very likely to have that dual diagnosis. But the definition for substance abuse is a repeated pattern of substance abuse that can result in intolerance, withdrawal, compulsive drug-taking behavior, and it affects a person's brain and behavior and leads to an inability to control the use of legal or illegal or even medicines. We've heard of opioid addiction. Sometimes it's the medicine that gets prescribed to you that somebody can develop this codependency for. But you want to keep in mind that it's that pattern, that repetitive usage that now starts really affecting the person's brain and also behavioral aspect to it. And usually the severe component of a chronic substance use disorders are commonly what we refer to as addiction. And then you may ask yourself, why does my employee get into those situations? Why does my family member get into the situations? Why do I, if it's for you, why do I put myself in this situation? So if these are the questions, usually the reason why people seek the effect of substance abuse or substance use is for different levels. It could be because that feel good, that euphoria, the feeling that you're having a high per se of emotions. Just again, that feel good component. They might be using it to feel better, forget about their problems, feel numb, because sometimes that feeling is a lot more bearable than really facing a memory a situation, an issue that's arising. So really, they aim to use alcohol as a way to forget. Maybe it's also they believe that by drinking more, they perform better. Sometimes people numb their anxiety with it, so they feel like they're actually performing better or thinking better or becoming better problem solvers, when in reality, that's not the case. And sometimes they also just give in into curiosity and peer pressure. This is going to be more of an effect for somebody at a younger age, but that experimental phase can also lead to people seeking more, especially depending on the state of well-being that they're exposing themselves to this experiment of consumption. One of the symptoms to be aware of, or what I like to call warning signs, especially when we talk about addiction and substance abuse, it's that withdrawal from friends and families. Usually when people become very avoidant, it's already a sign of something's happening. And one of the biggest thing is if it's a change of behavior. Usually they are participating in events, they have a great time socializing or making time for friends, but lately maybe they've withdrawn, maybe they're no longer participating in these events, and it's not that they have other plans, but they're refusing to go, they show no interest. So that withdrawal can very much be a warning sign. And some other symptoms of somebody going through substance or addiction: sudden changes in behavior, that erratic, that mood change that really makes you question, well, that this is again unlike them. That those behaviors, they're a sign of something underneath internal happenings. So the earlier you can address it, the earlier you can bring it into surface of concern, the earlier we can treat it and talk about it. And they engage in risky behaviors, almost as if there's no consequences to things, because they're trying to, again, numb that pain, numb those problems. And even though other problems might not feel as painful, it's almost worth it to get themselves in other type of trouble to keep their mind preoccupied. Developing a high tolerance of withdrawal symptoms and feeling like you need more to be able to function. They've developed that tolerance, so now they feel like they need to intake more to get that same effect. And in the workplace, it might look a little bit like excessive substance abuse. You could see them going to parties all through the weekend, and on Mondays they're not really abusive, but now they're showing up to work unwell. Maybe they're not shaving as often as they used to, they're not keeping their hygiene up to date, and it's a behavior that again raises concern because it used to not be like that. This is a new behavior, this is a changed behavior. It brings you that concern, shock to that person, what you're seeing that person go through. Fractured relationships at work, especially, this is a good one to keep in mind whenever you've seen them be really good at having a good relationship with their colleagues, with the workers, even with their manager. That fractured relationship starts showing off when somebody is possibly going through an addiction or self-medicating with a substance, whether it's illicit drugs or alcohol. Alcohol tends to be the most popular one when somebody tries to munch, just because it's so easy accessible. But really, those fractured relationships at work will tell you a lot about a person, and if there's something going on, and it could very much be a way for you to intervene and say, I've noticed this relationship change, what's going on, in a professional matter, especially. But if you do know this person, that could be a great question to use, especially if you've noticing the symptom, to be true to that person. Associating with other substance user, the guilt sometimes leads to avoidance. So whenever somebody is still trying to put themselves in social situations, they tend to lean into people that are also abuse the alcohol or the substance that they're chose to abuse, and they're trying to just really not feel as guilty within that group. So they will most likely start associating with other substance users. Substance dependency is a repeated pattern or substance abuse that can result in tolerance, withdrawals, and compulsion drug taking behavior. When we look at this dependency, it's again Now they're really leaning into the substance to be able to function. They really start, this is where the addiction starts really shaping because they're dependent on this substance. Tolerance. This tolerance is present when the individual has to use progressively more and more and more over time to achieve that exact same high. They get, if they started with just one glass a day, and that made them feel good for that day, maybe next time around they really need two to have that same effect, until two becomes five, when five becomes 10, and that tolerance keeps building and building and building, and then it keeps damaging the brain. It creates a lot more dependency on it, and when you decide to withdraw from that or take it away, the withdrawal is greater. And when we look into the characteristics of withdrawals, is a set of unpleasant physical symptoms that are opposite of effects of the drug. Sometimes this is what keeps people from having a successful sober when they become sober, because they start experiencing this unpleasant physical symptoms that they also want to numb. They also want to forget that they're feeling this way, or it's almost as they can tell themselves, I'd rather keep drinking than have to feel this way physically. So that is what the withdrawal can be experienced as. And then the compulsive drug taking behavior, including uncontrolled use of the drug and craving the drug and excessive amount of time devoted to obtaining the drug. This is going to be when somebody goes out of their way to really seek this drug. They're trying to, sometimes they even put themselves in risky situations to get access to this drug, or access to the alcohol, whatever it is. They really do not assume the consequences and the risk and really assess the situation, but their focus on is getting the substance, getting this thing that now they're codependent on and they need more of because they developed that tolerance. So they just engage in more drug taking behaviors. Substance misuse and problems in the workplace. The reason why we want to continue to bring these conversations into the workplace is because it not only affects an individual, but it affects the workplace. And in return, it can also affect the team. It affects the performance of a lot of the projects that you might be part of, but it also affects the family. So some of the things that problems that we might be able to see is loss of productivity. They're not getting things done as they used to. They don't have the focus to do so. So they have loss of productivity, loss of job performance. They're not performing the same way that they once did. Workplace accidents and injuries. This is especially important if you are in a field that requires you to handle machinery, maybe factories, and you're not quite present there. Your brain has alcohol in the system. Maybe it's been fogged up, brain fog has happened while in the process of consuming this drug, this illicit substance. So it could really affect the way that you can effectively manage or run this equipment that is required to perform your job. Employee absenteeism, come to work late, maybe even call in sick a lot more than usual because of the hangovers, because of the after effect of a drug, or whatever the case may be. The employees do experience an increased level of absenteeism, high turnover, quitting, resigning, low employee morale. There's not that same environment that the employees experience, and also the uncomfortable situation that some people can be put in within the team. Maybe the individuals are showing a lot more aggression, irritability, so they could decrease the level of morale within the team, within the company, within the department, and we want to address that. Theft, sometimes just, again, that risky behavior that they're engaging in order to get more of something could lead them to stealing from their coworkers, to stealing from loved ones, even family members. And conflict among employees or with the supervisor. This individual has now become a lot more irritable, aggressive in term of it has anger outburst, and this can really fracture some of the relationships they have with employees and the supervisors. When we look at work, these are some of the factors that contribute to the high risk of an employee. So if they're experiencing this within the workplace, they're just being input at a higher risk to use alcohol or drug abuse, or abuse the drug or the alcohol in order to deal with the problems. That is loneliness, long hours of not having support with the family, maybe being taken, maybe this job requires them to travel a lot or to be away from their home a lot within a space where they don't trust a lot of people. So that loneliness can increase that risk behavior on relying on alcohol to numb the feeling of emptiness. Work stressor. Maybe it's a project, deadlines, not accurately setting expectations for the team, or maybe not accurately managing the team to be able to complete this project, and leaving it all to one employee can add work stress to this individual. So if this is the case, having a set expectation of what the project would looks like, what the timeline is, do they have enough team members for this project, what does that look like for them? Because if it's adding more pressure to the deadline, maybe they don't have support, it could really take them at a higher risk of using substance abuse in the workplace to deal with those stressors. Long hours at work, putting in at overtime at an uncontrolled rate. Maybe it's okay to do it every now and then for certain special projects, but if this is a constant expectation for the employee, there needs to be a preventative approach to dealing with a substance abuse risk, or maybe other illnesses like depression, anxiety that they need to be mindful of. But long hours can increase the risk of an individual developing that codependence on substance abuse to get that feel good feeling or forget the problems or the stress. Physical pain, your body will start speaking for themselves. If a lot of stress throughout the work, a lot of physical demand for this position or at work is required from an individual, they're going to start manifesting those pains physically, but also they will start using substance or drug abuse in order to forget about that pain and numb it. Now let's go to the next R, which is refer. In terms of prevalence and age onset, many questions can be like, well, who's at risk? How old is somebody starts developing these addictions? And we know for a fact that men are usually more at risk of becoming addictive or really depending on drinking or using drugs. And the earlier you use it, the higher risk you are. That early experimental phase, if it was done anywhere between 15 or earlier, they're just 4 times more at risk of developing a substance abuse disorder or an addiction. Some of the mental health professional providers to keep in mind, and this is, again, not for you to become a professional at diagnosing or knowing what to do. It's just so you're aware of. Education is going to be highly encouraged when it comes to understanding the mental health world and realm of network. Same with some of the treatments. So I'll talk that in a little bit, but you want to be able to refer them out to either primary care physicians, maybe a counselor, therapist. Psychologists are great for it too, psychiatrists, and treatment facilities. The important thing about treatment facilities is more likely than not, you will face somebody that is dealing with some withdrawal symptoms, and having a facility might be the best treatment for them if they need to have a recovery treatment and so on. So usually this is a lot more popular when it comes to treating addictions and substance abuse. And again, just to keep in mind that this might be something that treatments might call for, or a professional might call for as far as treatment, is detoxification. And that's just the removal of the substances from a patient's body. And this needs to be done in a professional manner from a professional and be supervised. Psychotherapy, patients are taught to handle stress and situations to alter self-defeating thoughts and irrational beliefs. So you want to keep in mind that talk therapy is able to challenge them, to rewire their way of thinking, their paranoia around what people are thinking about them, who they're disappointed. So talk therapy is going to be very important in the process of recovery. Now let's talk about how can we relate to others? How can we learn some skills to, and not only the stigma or fear around somebody that is dealing with addiction or substance abuse. These are some ways that we can continue to relate to somebody. We want to be compassionate and understand how this illness or this dependency show up for them. How can you understand the withdrawal symptoms? What is the expectation for the recovery? Create opportunities to learn more. Just being here and sitting through this webinar, this short webinar, to understand what this could potentially look like for somebody is very important. So creating moments of education to help you understand the concept and also the stigma around it. React calmly and rationally. Help them understand if they're going through a moment of irritability, high stress. React calmly so somebody is in control of the situation, and more likely than not, you're going to be the one that has to bring some rationality into the conversation and understand how they best need to be helped. Shift your language. It's not about being weak. It's not about not being strong enough to face their challenges. It's just that biological component in there, that cognitive component is fractured. We saw the brain image earlier, and there are some parts of the brain that are just not awake or they've been damaged. So you want to be able to shift the language to have a more productive conversation around what should help them and what should help you in return, or the team, the workplace, or in a family dynamic. And remember that diagnosis is not who they are. It's something that they're living with. That is not what characterizes them at the end. Keep in mind that relapse is very common. Repeated drug use can cause changes in the brain that may affect an addicted person's self-control and ability to resist cravings. It is very likely for people to relapse. It is actually more than 85% of individuals relapse and return to drug use within the year following treatment. And researchers estimate that more than 3/4 of individuals in recovery relapse within weeks to months of beginning addiction treatment. We talked about withdrawals. Those physical components can really take a toll on somebody. So relapsing might be a viable options that they go to in order to numb down that physical pain, and also that existing emotional pain that they were going through that made them seek that dependency on the substance. We want to understand that there are ways that we can prevent relapse. Once an individual completes detox inpatient treatment, and you want to focus the shift in how you help them avoid relapsing situations, like situations that make them exposed to drug use and alcohol use. So you want to make sure that you're avoiding that situation in order for them to not be exposed to that drug, that substance abuse, alcohol, and then eventually end up relapsing. Usually the best way to treat anybody that's dealing with this addiction of substance abuse is going to be a combination of medication and psychotherapy, or maybe a support group. So one support group that's very common for in this conversation is the 12-step program, which you can find one either at your community event, look it up online to see if there's one near you, if you need it for yourself, an employee, or even family member. It's great to have an understanding of when and where these meetings are happening, so that way you can let them know if they need help. This support group meeting is happening, this 12-step program is happening, and it could be very useful for them to have that information in order to seek help and start that process of healing and recovering, while still making sure that they're seeking that treatment. That's the most important step of helping them normalize that asking for help and seeking treatment is a very powerful thing for them to do for themselves, their workplace, their career, and their family. And one thing to also keep in mind is recovering addicts are taught to significantly change the way they live in order to avoid a relapse. This might look like not longer going to happy hour after work, or maybe happy hour after a big project. Whatever that looks like, they're encouraged to modify certain aspects of their life in order to not be exposed to this drug, to this addiction that will then contribute to relapse or put them at risk of relapsing. We want to keep in mind that our attitude around substance misuse. Sometimes substance use disorders have a neurobiological basis. They should be treated as such. So you want to understand how just our way of shifting and thinking and talking towards somebody that is going through a substance use problems can greatly benefit them if we do it in a positive way, in a constructing way, instead of a belittling way or in a judgmental way. We want to start shifting our mind so we can help them not only seek that help, but also maintain that sobriety, maintain that ability to not feel codependent on the substance, and then to go through again the process of healing all over again or seeking recovery again. When we start approaching this conversation in a preventative way, we can start seeing very positive impacts. Just in the workplace alone, some workplaces that have applied a action plan for substance abuse prevention and treatment have seen 91% decrease in absenteeism, 88% decrease in problems with supervisors, 93% decrease in mistakes at work, and 97% decrease in on-the-job injuries. They're able to be more attentive, to be more present for their workplace, for the projects. So this is all great impact from just having a substance abuse prevention and treatment action plan. Here at Gateway to Hope, you will always have access to not only myself, Carolina, and the team at Gateway to Hope, but you also have a topic-related resources that are always going to have the formula of a fact sheet, a relate sheet, and a topic blog. For substance abuse and addiction, the fact sheet will look a little bit like this. You will provide that, and you'll be able to download this from our website and get access from your internal organization also. This is just a great way to identify false information that can be going around in your community, in your workplace, even at home. Understanding these facts can greatly help you have a more educated conversation around it. You'll also receive a relate sheet. This is a way that you can be proactive about it. What are some actions that I can take as an individual to support and show this person empathy and be able to let them know that you're there to support them and give them tools that will allow them to feel a little bit more control, or that it's okay to ask for help. We'll also include a topic blog. This blog will have understanding of what it is, a little more condensed information about some of the signs, how to recognize it, and some signs, so that way you are better equipped to recognize how substance abuse and addiction may show up in the workplace. You'll always have access to the Hope Line. The Hope Line is currently open from 5 to 8 p.m. and we hope to expand and extend the hours in the near future. As of right now, that's going to be 5 to 8 p.m. Central Time. You're able to use it for two things. You're able to use it for peer counseling while you're seeking help or waiting for an appointment to happen, or if you just need to vent or talk to somebody. This is called a warm line, so this should not be used as a crisis number. If somebody is at crisis, call 911, let them know that it is a mental health situation or someone in mental health distress. So just disclosing that will be very helpful. And also, if you need referrals for mental health professionals, they carry a large database that has been vetted, and this is great numbers for you to have access to. So always feel free to use it for yourself, for someone you care about, for someone you love, for a coworker, a colleague, or anybody that you come in contact that is displaying mental health distress. At Gateway to Hope, we've also developed our own app, the Mental Health Gateway app. It's the full name of the app, and you're going to be able to get access to PDFs, videos, guides, and workbooks. This is going to be accessible to anybody. So if you have somebody in your family, in your workplace that just needs to understand more at their own time and their own pace and have access to their phone quickly, this is a great app to have. You'll also be able to access your training from there if you are a GTH participant, and also look into our special forums. We have for mental health champions and mental health coaches access to the forum where they can talk to each other to better be equipped at handling questions that might arise for their church, their community, how they can help around mental health and be advocates for the community. You will also be able to access the GTH provider database. Again, this is a limited feature for mental health coaches, but they'll be able to use that database to make referrals too. Carolina and myself are the community education coordinators, and this is our contact information if you ever need to email us, ask any questions, or if you're faced with certain specific questions or situations that we might be able to help you navigate. And as always, we're constantly adding new resources to the public. So feel free to follow us on our social media. We have our Facebook, Twitter, Instagram, YouTube, and LinkedIn presence for you to be able to access many of our resources and be up to date on upcoming events. And again, maybe even a post on little helpful tools to continue to work on your mental health, especially in the workplace.